Hey everyone, this is Lacey on the Your Lyme Matters podcast, and I am joined by Julian, and I'm going to make him say his own last name for me.
My last name is Cimadamore.
There you go. Yeah, I asked just before we recorded, so I didn't butcher it. There you go. And he is joining us all the way from Ontario, the Richmond Hill area. Julian, why don't you tell us your professional background to let the listeners know who I'm chatting with today?
So my professional background to date is I'm a certified holistic and functional nutritionist. So I've expanded my knowledge into the field of the functional medicine approach while utilizing all the components of, healthy lifestyle, healthy nutrition, but in complexities, right? Things get more obviously escalated. So the functional, whether it's functional labs or functional medicine, helps to dive a little bit deeper into the individual to help figure out what are the root causes. And that's my primary focus right now in my background in education and practice is focusing on the root causes and how to restore the terrain that have caused those dysfunctions.
Right. So, sort of focusing in on the environments of the body itself and the root causes. I myself latched on to a root cause healing approach over here for my treatment as well, because the other approaches weren't quite deep enough to get at the multiple different things going on. So, very pro root cause over here. And also, what the listeners might not know is that Julian has also had a journey with Lyme and co-infections. Julian, which infections were you diagnosed with?
So diagnosed firstly with Lyme, which is Borrelia, and then also with Bartonella, and then specific species of Bartonella, specifically, Bartonella Hansel. And then as time went on, I was actually diagnosed with Babesia, but that did not show up first on testing, right?
Okay.
Which is could be quite interesting for listeners, right?
Yeah, yeah. Do you remember any of the companies you did some of that testing through? Like where were the ones that it didn't show up on and then the ones that it may have in the future?
So I predominantly only used Armin Labs. When I've retested over the years to see how levels are going, that's when Babesia did show up after years of, you're treating specific infections. One usually rises to the surface, right? But I've only predominantly used Armin Labs. I use Vibrant as
Yep.
well, but haven't personally used Vibrant Wellness for the tick-borne. I still, because I had baseline from Armin, I just continue to utilize it because, sure, the markers were obviously showing specifics and to keep track of how it showed up on the test results and how I actually felt from a symptom picture too, right?
Yeah, that makes total sense. Were you born and raised in Ontario or did you come from a different province or area?
So born and raised in just outside of Toronto area in a town called Maple, Ontario. Grew up very athletic, played lots of sports. I was actually a predominantly a hockey player, as people will know from missing teeth right now.
I do too. I just have a temporary thing, and to be honest, so my partner would probably the same thing. I don't wear it all the time because it's less comfortable. So, yeah, I also have missing teeth for people to know that, and I don't play
Yes.
hockey.
So
Mhm.
yeah, I grew up playing highly competitive hockey like throughout my whole life. My whole life was basically hockey. Played high level, AAA here, played in the Ontario Hockey League, which is the OHL as they call it. And then from there continued to play hockey at university, went to University of Western in London, Ontario. And that's when things started to flourish in a sense from a symptom picture. And then I guess we could talk about my story too.
Yeah,
Um,
anything you want. Yeah.
so basically, there was that one night. Basically, I remember things just started to be dysfunctional. Meaning, I had heart palpitations throughout that first night and didn't know why I was having heart palpitations. So, this is at the end of first year university for me. So, I think I was 22, 23 at the time. I thought I was having a heart attack. Had the phone on me, do I have to call? Like, what do I do type of thing. This is in the wee hours of the night to morning hours type of thing. And then from that day, symptoms were just not the same. So I had crazy anxiety because I was having heart palpitations and I was running to hospitals because I thought my heart was the issue, right? Something's going to happen. We need to check it type of thing. So I guess the anxiety stemmed up from that too as well. As the next year progressed, I started getting like more like the skipping heart rates, especially like playing hockey, like, high intensity. I would get like thumping and skipping.
Mhm.
At that time, I started getting more of the digestive complaints started to come in. So I was getting like more of the constipation piece or the IBS type of picture coming in, flip-flopping from depression to anxiety. So days where you have crazy anxiety to days you have had crazy depression. Did see a mental health practitioner at the time during university. At that time, not knowing everything, did take antidepressants, anti-anxiety types of medications, more the antidepressants, which did help, right? But still had the heart palpitations and skipping, still had the digestive complaints. So as time kept moving through university, getting into my third year now, I started getting more of the neurological piece. So I started getting the vertigo sensations, the spinning sensations. I started getting some random twitching in my legs and twitching in my fingers. I started getting like prostate issues at that age, which is kind of crazy to say. Feels like I had to urinate all the time. Then got into, more of like the sexual dysfunction. Like, why am I having these issues I'm 25 years old now.
Right.
But just kept pushing through because being a hockey player, you're kind of type A. You have to work out, you have to train really hard.
Yeah.
So I just kept pushing through. That brought me to basically the end of university. So around 25, 26, moved back home. Was now working full time for a construction industry at the time. Still had the same symptoms. So, anything from the neurological piece, like the twitching and buzzing to a degree, I would say. Still had some digestive complaints, still had, the heart stuff going on. Decided to see a naturopath, changed my diet, cut out gluten and dairy at that time, limited alcohol as well. And things got significantly better, but still this neurological piece still kind of lingered. The heart stuff still kind of lingered. So I just kept kind of, perfect. I'm on the right track. I'm feeling a little bit better. Just continue. As I kept working, I became a personal trainer as well. So I was working, 12-hour shifts for construction and then training at nighttime. After a few months.
I'll pause you there. When you were saying I was waiting, I was going to say because construction is pretty hard work physically.
Yeah.
So now that you add that part on, that is a heavy, heavy responsibility right there. So yeah, go ahead, carry on.
Yeah, so it's taxing the system. Well, obviously, you get into the whole adrenals and whatnot. So then, around 26, 27 years old, I hit kind of a breaking point, right? There was, I went through a stint where, the depression kicked in, very, very severe, meaning, I just didn't care about anything, right? Like I still went to work, but like nothing bothered me in a sense, meaning like I don't care what happens. I don't care about this. I don't care about anything realistically. And I was having like more of these like depersonalizations type of where like you just feel you're out of your body. You just like nothing affects you, no emotional attachment. And my symptoms obviously subsided because you just don't care about anything too, right? To a degree. Still had the lingering symptoms, but from that point on, after that kind of phase finished, a few months there, all of a sudden, like I just woke up one morning, I was in like just nerve pain everywhere, right? Like, my calves, my feet, my hands, just crazy nerve pain. Then that led in because I used to love working out, love go to the gym every day, even working after like 10-hour shifts or 12 hours, just still go put in a workout type of thing. So then I was like, okay, maybe I just need a break now. Like I'm just doing way too much. Gotta just chill for a bit type of thing. So I started backing off the gym, but now the symptoms were escalating even more. The vertigo sensations, the dizziness, now the buzzing sensations everywhere, the digestive complaints, the heart palpitations and whatnot. The anxiety now was extreme just because of more of the health anxiety types of scenario. So then at that time, as I'm weaning down, I'm like, hey, I just need a break. I just need a break. I decided to go back to see a naturopath Actually, I decided to mark down all my symptoms that I was having prior to going this time. So then they have a better understanding. Once I did like 2 weeks worth of jotting my symptoms and what was going on, from like the neurological piece to the GI issues to like the nerve pain sensations to the heart palpitations. First appointment, actually, he grabs his sheet and he puts like a stencil over some sort of checklist. I'm like, okay, that's interesting. And he looks at me, he's like, have you ever been tested for Lyme disease? And I'm like, no, I don't even know what that is, right? He was kind of like shaking his head, kind of nodding, but silent. And I was like, okay, interesting. Um,
Oh no.
yeah, so he's like, listen, I think you have like a lot of bacterial stuff, like considering you have like a lot of GI disturbances and constipation. Well, I'm going to treat you for calming the system and trying to treat the gut. I was like, okay, perfect, right? This is around, I think, like 26, 27 still. Started doing those aspects, started incorporating, but nothing was really getting better. And then at that time, I was actually transitioning to a new job. So I quit construction because I'm like, it's too much now. Like, I can't do it. I don't want to do it. It's not my lifelong career. So I switched to more of a, still in construction, but I was more of a site coordinator. So more in office, on site type of thing, which was great, but still had all these severe symptoms we're talking about, right?
Yeah.
So in that transition, started there. Once I started, things even got worse. Like I would have panic attacks on the site. I'll have like spinning sensations. Again, neurological complaints, lots of neurological stuff for me. Obviously switching my diet. I mean, at that time, actually, I was doing medical medium diet. So I was eating plant-based and heavy metal detox smoothie and doing the celery juice, doing all of that, right? Just because, I read his books, talks about Lyme disease, talks about all these things, how to heal it. Perfect. Incorporate it, right? 8 months into that job, I reached another breaking point where like I need to take time off. Like I need to settle everything down, heal in a sense, right? Was actually at that time too, I was, referred to a like functional medicine type of clinic, integrative clinic downtown Toronto, which I attended to, obviously, because he actually stated, if you have Lyme, I don't really know how to treat it type of thing. I'm like, fair, perfect, right? So on my journey again to the new clinic, they wanted to run all the tests, Armin Labs, the mold toxicity, SIBO breath test, hormones, everything. So my first appointment back there, that's when I got a diagnosis of Borrelia infection, Bartonella infection, mold toxicity, like high orchotoxin levels. I had crazy hormone disruptions for being a guy that was 27. I had bacterial overgrowth, I had yeast overgrowth. Seems like everything, right?
Yeah. The platter of it, because there's a common set of things that come with it, and you're listing lots of them. So you had a pretty full platter, it sounds like.
Yeah. So then got all these diagnoses and I'm like, okay, what's the plan? Kind of thing, right? So at that time they had a naturopath and an integrative doctor. So he personally asked, do you want to go on antibiotics or do you want to do the herbal route? Again, following medical medium, I'm like, I'm just going to stick to the herbal route for now. And he's like, fine, fair. So then the treatment they give you is like, 3 pages long, you're taking 30 supplements. But to me, I'm like, whatever, I got to do what I got to do. So I started on that journey. That was around like October of that year, like so when I was like 27. And then they referred me to the environmental clinic to work on mold detox, right? So I was doing like, IV therapy and colonics, trying to detox mold, simultaneously doing like a SIBO protocol and doing a Lyme protocol and taking all these herbs, right? And I just kept getting worse and worse and worse. That brings me into the next year, or the beginning of that year, where I'm like, I got to do something more type of thing, right? So I actually I went to the States. I went to Florida for treatment for 6 weeks, did IV therapy, did more holistic healing, working on a mental health coach, working on, all the aspects involved.
And was that with LLND? Or
No,
sorry, no, LLMD? Or
it
different?
wasn't with a Lyme literate doctor. This was just like a healing center that says they have treated Lyme and treat
Okay.
other, mold toxicity and detox and whatnot, right? So I went to Florida. That was the beginning of like January. Stayed there for 6 weeks. At the end of the 6 weeks, I was on the plane ride home. And I was like, well, this didn't even work. And I spent people's money, and I'm that kind of person that feels really bad. So coming back on the way home, that plane ride, again, thinking this didn't work. Like, what do I do now? Like, I'm lost. I have no support, no, like what's treatment look like what do I have, like what's going on type of thing. So I came back home and I basically had to fake being well in a sense. And that was a struggle. Obviously there was a breaking point with that, right? So after a few months of being home, I lost my job even prior, right? So I had no job at the time again. So I just started to go back to school. So I went to holistic nutrition school at that time. Also went back with my old naturopath, right? But also started to learn the functional medicine, the testing and whatnot on my own too as well. So I was utilizing basically just my ND that I worked with, and then, my own personal research and my learnings from school and whatnot too. So at that time now, I was in school. I found a part-time job because I'm like, I gotta work, like I gotta support myself through transitioned my diet. So I actually went from plant-based to carnivore diet at the time, and that dramatically changed a lot of things, right? Not saying everyone should be doing carnivore diets, but it made me feel tremendously a lot better. I put on 20 more pounds, right? So I'm like, oh, perfect. Like this feels really good. Still continuing my education, still working with the NG. I started to feel a lot better. As the year goes by, I started implementing specific herbs, understanding more about tick-borne infection, and understanding about more mold toxicity in the environment. Actually, prior to going to treatment in Florida, I had mold in the house, so the whole basement had to be remediated, clean environment. So when I came back, I wasn't currently exposed to those organisms.
Right.
So again, as years went by, now I'm 28, 29, things were getting a lot better. So started working full time, plus going to school, actually graduated school, and then started to do other continuing education in like the functional medicine types of area. And then things just kept getting better and better, and started utilizing GI testing to look at what's going on in the gut, how do I protect the gut, what specific things I can utilize, and then retesting tick-borne infections. Again, using specific herbs that are being researched to help kill the organism. But also now you get into like more research on like the whole persister cells and like the Lyme forms and like Bartonella, like that's a harder thing to treat. So start focusing more on specific areas of my needs and my symptom picture. And then I'm 35 now, so the last 6-7 years have been an interesting healing journey, but I would say every year has gone a lot better with things that I've incorporated personally. And sure, I had a naturopath to support different aspects too, which is great. But without understanding more of the whole picture, like we get into the whole mast cell and histamine response too. That was part of my picture. Those were supported. Things got even better. Things worked a lot better now. So now I've gotten myself to about 90% better, and now incorporating more of the nervous system support, whether it's utilizing specific frequency therapies or FSM, which is frequency specific microcurrent. So that helped me tremendously a lot too. But the herbs for sure helped me push through different plateaus, let's say, right?
Okay.
And now obviously diet, not fully carnivore, but I, incorporate more your vegetables, more your healthy fats, sometimes even the grass-fed butters for butyrate production and whatnot. So yeah, it's been definitely a journey, but the
Sounds
journey
like it.
journey always continues, let's say, and we're always working on ourselves. But there
Yeah.
is more complexities to everything and each individual and even myself, but everyone is different and has a different approach too. But it's knowing what you're identifying as well, right? Which is important.
Right. So currently still taking some herbs then?
I think herbs are just great in general because they're anti-inflammatory. They help with circulation. They can help with liver, kidneys, lymphatics. So just general, instead of taking your traditional multivitamin, I rely more on the herbal approach because they can provide certain phytochemicals, certain nutrients as well. But I'm not treating specific conditions, more general health, overall wellness. But I think supporting my whole terrain, and that's kind of how I was saying, that's in practice we support the terrain. You have to support people's history too. So that's where like the supplementation can become different and should be specific to the person. If you've had mast cell issues, you can, still utilize some like things like luteol and maybe even quercetin, for example, from time to time, right? So you're always kind of trying to always fix that damaged road as you go. And then sure, diet, lifestyle measures, exercise. Now I'm back to playing hockey, which is great.
What was that reintegration back to playing hockey? What was that experience
Yeah,
like?
so I did at that time when I was doing treatment in Florida and whatnot, I had to quit. So I quit for roughly 3 years. Once I gained my strength back, I started obviously working out, not as a hockey player anymore, but just for general wellness. And then the escalation was okay, like, hockey started like men's league, right? Like men's league starting. I don't have to push myself. I can just start playing type of thing, but I was working out prior. So it was a gradual progress to get on the ice, right? But even when I got on the ice, it's not like I'm going for like a hard shift off the bat, right? But now I'm always competitive. So yeah, I push the limits too. But now I also learn how to recuperate, how to recover properly. And that comes with nutrition, lifestyle, sleep, and I would say specific frequency medicine too.
Okay, interesting. Yeah, I've heard a lot of people talk about the frequencies. I've not actually used a machine or anything, but as what you're saying, some people find it very helpful as part of their treatment regime. I'll kind of jump back a bit, way, way back. Did you have a regular family doctor you were connected to when you first started getting sick? Like, what was that process like for you navigating with not functional practitioners?
Yeah, so I did have an MD, my like general practitioner at the time. He was actually really good about it considering what you hear from other people. He always got me referrals to cardiovascular specialists or the neurologist or the rheumatologist. So I saw all those, multiple of those, but he was very good in the sense that he would give me like blood work, for example, if I needed blood work, or it's hey, my ND's asking for blood work, can I do these things type of thing, or if I wanted them personally because I started studying more about blood chemistry, he
And
would,
your MD was open to it. That's pretty good, to be honest.
which is really good, and
Yeah.
still and even still to this date he's really open about it. I think because he understands to an extent. I think he's like Lyme disease, right? I don't know how to treat it, so like whatever you need, you're a good person, like I'll do anything kind of to support within obviously the system measures, right? Because like the audits and whatnot. So trying to utilize that standpoint, scans or whatever you need type of thing too, right? So very open, which
Awesome.
is great because a lot of MDs kind of think it's all in your head and they put you down even more, which you don't want, right? I don't think you need that
No,
added
no,
strain of stress or pressure. It's just, hey, like I'm being honest with you, like I pretty much I don't know what to do. So whatever you want help with, and I can help you with those like imaging specialists and whatnot. But other than that, he's not forcing pharmaceuticals at you or trying to say, hey, just calm down. It's you're just having like anxiety type of thing, which you hear a lot nowadays, unfortunately. But yeah, pretty open, which obviously helped the process with gaining additional resources, especially being here in Canada, we don't have a lot of those resources, right? So
yeah. It's
um,
slim pickings around here for sure. Like
it's good.
there's,
It's
yeah,
good to it's good to have the resources and connections. And now I personally work with like NDs, on in Ontario, and then in BC they're allowed to prescribe antibiotics. So in cases now, we're able to get them specifically according to, do we need this additional support because it's going to help tame things as things move on during specific phases of treatments or whatnot too, right?
yeah, that makes total sense. I'll jump back. You said you're the type of person that feels a little bad if you're asking money from people. Now, whatever within your comfort level, because I know for me, there's certain years I just basically decided I was like, I don't think I can really ask anymore. Just it felt pretty darn uncomfortable at certain points. I guess what was that experience like for you?
I had a fundraiser
Yeah.
which helped support basically to go over into another country to utilize specific treatment strategies there. Afterwards, yes, asking a kind of last resort to utilize treatments here financially because I was doing ozone treatment at the time. And those could get fairly costly per session. So I asked for basically an investment of an individual that liked me and cared for me and had a lot of investments otherwhere. But that was kind of the last straw. So basically, after utilizing all that, that's when I started to take things more into my own hands with what I've experienced during specific treatments, whether it was these types of IV treatments, whether it was ozone therapy, whether it was herbals or vitamins and minerals and whatnot. I kind of gathered all that information and started asking the questions, why? Why weren't things working when they're specifically tailored to work, so they say, especially ozone therapy. Yeah, do 10 bypass, 10 to 20 sessions, you should feel better, right? But I didn't get that effect. I actually had a lot of failed treatments, a lot of failed herbs, a lot of failed everything. That brought me into always asking why, but why? Why aren't things working? Is it the environment? Is it the nervous system? Like, what is going on that's making the body not wanting to heal? Because obviously the body wants to heal given the right environment, but why aren't things working as accordingly, or what's published or what's researched type of thing, right?
Right.
So that I kind of surrender to that approach. Right? I'm like, you know what? I kind of just surrender. I'm gonna stop doing all these crazy things, whether it's from a treatment standpoint, whether it's this biohacking things that they say they work, but it depends on the person. And then I just started again. I was in school, actually starting to graduate, started doing kind of my own types of protocols and treatments and utilizing the naturopath to get additional recommendations and sources as well, research, which is great. And then that's when things started to go more uphill for me too, right? So yeah, I'm using my own journey from experiences, treatments and whatnot, and then utilizing now, okay, what's been researched, what's the individual present with, what do they have from testing and whatnot to restore balance. It's very expensive when someone is diagnosed with Lyme, right? And I think now from learning from what I did personally, I think finances need to be used specifically according to the individual. I don't think all the more expensive treatments are the best route to go for people. So I've learned from our history how to utilize finances too, because yes, things are going to cost, like from the supplement standpoint for sure, the herbal standpoint, if there's prescriptions involved like antibiotics, and depending on the insurance providers and whatnot, or what can we put value in, and what are we investing in, like from a detox standpoint, whether that's like an infrared sauna, whether that's utilizing like other things like coffee enemas or doing hyperbaric chambers and whatnot. I think all that stuff has its place, but at the end of the day, you have to figure out what's going to move the needle for the person too. And sometimes it's not doing these big expensive types of treatments, right? So finances are huge, and it should be planned accordingly to the individual and how it's utilized, and for treatment, the long-term approach to the utilization of specific herbs or other supplements, and then into specifically if they're utilizing IVs and all the other biohacking types of treatments or oxygenation types of therapies too. Not to say that they're all bad. I think things come in at a specific time and place according to the individual.
What my current functional medicine doctor used to call it putting out fires. So we literally focus on certain things, like one that's going to cause way more destruction than the next, and we'd strategically use, because she knew my finances were and still are very limited, so she knew exactly, and she'd ask me, but will you be able to pay for that? And I'd have to bite my pride, and then so if not, then we pivot. Okay, like what can I give you that you're actually going to do then? And that's super important. I would imagine that's something that's a consideration for you in your mind, in general with people. So that's actually really nice for me to hear.
Oh, I think it's
Yeah.
massive, to be honest with you, especially because going back to like we started, it's not just ever Lyme that's in the picture, right? If there's mold toxicity, I got to put money into potential remediation now in order to heal. So the value goes more into there, but people are they don't know what to do, right? Which
Yeah.
I get it. It's very complex in the environmental world, but it's educating the individual, because if we're not in types of environments that if we're exposed to, then even treating Lyme is going to be very difficult to do. So where's the value of treatments coming now? it's not coming to these oxidation types of therapies, for example, it becomes, hey, clean up the environment, because the environment is going to decrease your immune response, which you feel better too. So it's not just what we take and what we have to do, it's what we have to mitigate if we're exposed or have, if someone has those potential concerns or issues in their environment, whether it's work, home, or car potentially, sure, that
Yeah.
helps symptom relief and helps the immune system, because at the end of the day we need to build resilience to that. But again, the finances should be used appropriately to their current lifestyle factors going on, what's their relationships and all that, what can they incorporate, because a lot of people don't want to take enormous amount of things too. But yeah, there are things we have to take to feel better, but it's utilizing again those finances specifically to what's going on in the current situation that's gonna help too, and how does that gonna move the needle into the future.
And so when you were going through this, I know there's transitions for jobs and environments and all of that stuff. Did you have any online community or anything like that for support? What was your support like?
So my support was, I saw multiple naturopaths. They provide support, especially when you're picking more of your specific naturopath that focuses on environmental medicine. So knows the in and outs of solvents and mold toxicity, chemical exposures, ways to detox, all that. Then, practitioners that focus in the treatment of, say, Bartonella or Lyme specifically, or Babesia, co-infections, whatever else type of thing. Also Facebook groups, tons of Facebook groups, Instagram groups, obviously people that have the same experiences in the local neighborhood sharing their experience. Who do they see?
Mm-hmm.
Other healing modalities. But from other support, obviously I utilize mentors and always have. So like from the start, Dr. Neil Nathan was a mentor and always followed his research and ongoing research currently to date, specifically in the sensitive types of patients, the complexities there. Lots of support from just general reading, more reading, gaining a better understanding. Obviously, going to study more, like in the US, from the functional medicine approach, utilizing their groups for treatment cases, understanding ins and outs of any type of complicated symptoms or conditions and how they can relate to, say tick-borne or autoimmunity in general, utilizing those support groups. Yeah, that's
Okay,
pretty
so
much
yeah,
it.
so you had sort of
Lots
a mix, yeah.
mix, yeah, always continuing to investigate, right? I mean, I know it could overwhelm the nervous system, so you would want to be cautious of being in too many groups, right? Especially if people are sick, because they always kind of, I gotta take this, I gotta take this, now they buy this, now I have to take this. And it can be too much to the system and too much for like the nervous system, right? Where, you know, sometimes it's like too much information is bad, right? But
So,
it's the,
so depending on each person's individual nervous system state and mental health state, probably, and also where they're at in the journey. But the unfortunate thing is, a lot of us, until we kind of get the team of practitioners that also knows where we are on the whole journey, it's super hard to know. I was in Facebook groups that were pretty helpful. Perhaps if we're both in Canada, there's a good chance maybe we're in the same ones there. But
probably.
yeah, but yeah,
Most
so
likely.
I definitely found, to be honest, sometimes I would post questions in there before I went to actual regular doctor's appointments, so I felt a bit better prepared. And a lot of the times, the answers were better in that group for me than when I went to a mainstream uninformed doctor, not Lyme literate, not functional literate.
Yeah.
So so it's always a split, and I always like to tell people whatever works for you, because some people, they really are against support groups and some people are for. I remember for sure feeling like, feeling a little lack of support, not from the social groups, those were awesome, but in general in my life, because I couldn't explain what was going on. So it was sort of like a trap, a mental trap. Like
Yeah.
I couldn't get the words to explain to them how bad it was. And then people were sort of looking at me like, why can't you go back to work? And things like that. Yeah, I don't know if you dealt with any of those pressures.
Of course. I mean, the whole social gatherings, for example, or relationships, for example, that either come to an end because they don't fully understand, right? And
Yeah.
then you're kind of left kind of on your own. So there's definitely hardships going through something like this specifically because it's not like something you read a paragraph and have a full understanding of too, right? And people, or a lot of people are not going to comprehend, what it is actually doing to the individual. It's like full systemic types of symptoms, giving you these different types of, whether it's a mental health disorder, whether it's chronic GI symptoms or chronic pain, whatever, that puts a halt onto like your social life. So yeah, you get into situations where, oh, I can't go here, or I can't eat this, or I can't go away for the weekend because I don't feel well enough to do so, right? And in relationships too, specifically, it's like, well, if they keep hearing this on a repetitive basis, they start thinking like, what's going on with this person? And then like your whole mental health towards them, you start getting into battles in relationships or with, family members and whatnot, and it puts even more of a strain in it. And then again, it's like the same idea. It's like there's a breaking point for people too, right? Or they either they lash out or they let go. So,
Yeah.
it's very hard, right? There are certain individuals that will understand and be by your side, for example, and give you that support, but a lot don't, right? And that's the whole point is we're trying to educate people on this too as well, education to pass along in situations where they're dealing with these types of issues. So it's comforting. They understand that it's a process. They potentially understand what other factors are involved too. And we need that additional support to help, again, regulate the nervous system. But in
Yeah.
our world too, things happen for reasons for everyone in life too. So there's things that you have to let go, and maybe it's for the better too as well, right?
Yeah.
So
Yeah.
it's almost like readjusting your life to a better place and
Yeah.
foregoing kind of what's been causing maybe potential issues that don't need to be involved anymore.
And the nervous system might feel differently once it sees it from the other side, a different dynamic of relationship, or some are not as much. It gives you a chance to actually see what your nervous system is like without it too. So there's that
Yeah.
aspect.
It's a huge component. Without it, I don't think anyone fully gets to a state, or they've plateaued in a sense, or they can't break the barriers. So it's never just about treating the infections. It's always kind of working on these specific aspects to have a perfect circle, more of a holistic type of approach. Without utilizing those components, I probably wouldn't be at the place where I am today, right?
Yeah.
So,
Yeah.
and I think most people, I would say almost everyone can almost agree if they've gone through specific experiences, whether it is Lyme or even autoimmune conditions too, that there's things that they have to address other than treating infections, right?
Yeah, yeah. And
And
actually, I'll go back to one of your points. My question I asked sort of what supports did you have? And you mentioned a naturopath. The naturopath that I see from the United States, she travels to Canada. She'll actually stop mid session if something mental health is getting in the way or a relationship dynamic is getting in the way. And she'll just stop right there and she'll get you to talk about it. So just your approach there where you have to consider everything, sometimes something like that might be slowing or impeding certain areas of healing. So
oh yeah, for
I
sure.
appreciate when practitioners can do that in a respectful, still kind of compassionate way to get that across, and she does that very frequently too for me. So yeah.
That's amazing. I think that's where after seeing a lot of naturopaths, typically, not all, right? It's like you go for your initial, you have like your initial consultation, and then like here's a follow-up in 4 to 6 weeks type of thing. And you're kind of left in limbo, like take all these things, like why am I taking them, what to do, how to get them, whatever. So I structured it more like your experience where it's have the communication and the follow-ups, but educate them as time is going. Be like their counselor, be their someone that kind of looks up to you in a sense, right? Because they're going to need you by your side when things are in the rougher waters, and that's healing. You get into the rougher waters, but you're able to come out of them too, right? So it's providing that additional support when it comes to the mental aspect, the traumatic aspects of it, because this has created a traumatic aspect, especially if it's been years of chronic Lyme, right? It probably left numerous disasters along your terrain, from the financial, the relationships, the family, everything. So it's how do we work on that component too to increase the likelihood that these other factors like the supplements, sure, that they're going to work too.
Yeah. And even for practitioners too, like, because as you said, maybe not all practitioners incorporate that or consider that part of it. So, and
Hmm.
when you were talking, I was thinking, when you're like, be their person that they go to, I was like thinking, be their safe space. Because a lot of people don't have a safe space. Their cells feel threatened in maybe their moldy environment at home they don't know about. Perhaps the people directly in the same living space they're getting negative feedback from, so they feel threatened there. So practitioners are hearing this. Be their safe space as much as you can. And yeah, it
You
sounds
have to
like
be. You
yeah,
have to be for sure, right? You
yeah,
have to provide that social, mental support. But sure, provide the resources if we need testing and supplements and whatnot, for sure, right? Perfect circle.
yeah. And for you, Julian, what would you say, if anything, were the hardest parts about these battles with Lyme and co-infections and everything else? Like the parts where you came and you're just like, this sucks, or anything like that.
Yeah, I think with like chronic conditions, I think people get fed up. They're sick and tired of treatment after treatment after treatment. And with Lyme, it's like, they go through like 100 different types of treatments. So it gets hard in that sense because you feel frustrated and you feel, not to say you are depressed, but you just feel like let down in a sense too. Obviously, the difficulties with battling symptoms, depending on your age, being in my university days, right? It's you're trying to push through and get, like social gatherings and whatnot, or whether there's drinking involved because university lifestyle, or how people perceived you as, an athlete, but really you're battling something that no one can ever see inside you, right?
Yes.
So the mental game is the hardest battle, I would say, too, because when you're put into certain situations from how people look at you as, you're almost faking, you're being someone that you're not really that of, too, right? So, and I think that's almost worse long term because that builds up inside your nervous system. So without being true to yourself, you're never going to fully heal in a sense. It's actually limiting your capacity to do so as well and putting more of that stress response in it. So the mental game, I think, again, the hardest component on who you truly are and how you truly feel. And it's fine to express how you feel in a given day because that's normal too. We should be, we're going to have good days and we have bad days. I think that's part of everyone's how they go along life too. And it's good to express your feelings too. And if things are tough, then you don't have to keep it in, right? Or if people perceive you in a certain way, when is the time that you're going to actually show your true self? And how long are you going to wait to do so? Because the longer you wait, the worse it gets. And that's from my experience too, because again, I was perceived as this, guy who works out, looks really good, plays hockey, but then just forcing workouts, forcing who I want to be, forcing to be in specific industries where I didn't want to be. And there's a breaking point, right? And then it's time to come, I shouldn't say it's time to come clean, but you start
Or yeah,
expressing,
if feel free
yeah,
if it.
it's that you started expressing your own true needs and wants and who you really want to be and who you really want to become, right? And that brings a sense of regularity. And
So the mental game primarily. And would you say you're in progress of sort of the unveiling of the true you, or did that start happening years back in this journey?
I think that started happening years back in the journey now. Like I've definitely changed from how physically I am as an individual, obviously how mentally I feel as an individual, and how I got into this specific industry now, right? Obviously because of my journey, sure. Obviously the willingness to help educate and help others in this field. And it brought out a sense that I didn't have to be this type A personality all the time, on time, structured schedule. I think that's great to have a structure like that. Don't get me wrong. It's good to be organized, but also things happen too. So it's yeah, sure, restructure, but how do you plan accordingly so you have balance as well? And that's a huge factor, especially today's world too, and especially battling an illness because if people have family, they gotta spend time with family. They have to cook for their kids, for example, or those aspects, and then the social aspects too, right? So it's definitely changed the person I am today. It's actually setting time aside for yourself, and it doesn't have to be hours a day, right? As people think, but again, working on the nervous system, maybe that's 5 minutes in the morning or 5 minutes at nighttime too, because these things help accordingly, and they get deeper down into your true self. Because when you're self-regulated, right, your body starts to express what you truly want and need, and
Interesting.
you're able to express it, or you're able to dive down deeper to what does your body actually want, because symptoms tell all. It's like if I'm eating a lemon, your body gives that sensation that you're salivating. So same thing from an emotional standpoint, right? When you get deeper down and you try to figure out who your like true self is, you actually get responses. It's not like someone saying specifically like shouting at you, this is what you need to do.
Okay.
No, it's just like you're understanding what your capabilities, your strengths and weaknesses that we all have, and what you want to prioritize for yourself too. Like what's your own self-worth too. And that's very important, not trying to be someone who you're not, or use social media and whatnot. Sure, that's good for if we have businesses and whatnot, but that's still even prioritizing too. Prioritize business, prioritize yourself, your self-worth, what you have to work on for yourself, from diet, nutrition, lifestyle, and mental health, right?
Yeah. And so it sounds like there's been shifting points for you, and we'll dig a bit more into that. So what you said was you're harnessing the mental health. What was that journey like? Were you referred to a psychiatrist?
Multiple, yes. At the time during university, was seeing a psychotherapist, which helped try to understand what's going on. What are you feeling? Sure. Obviously, the medication standpoint, taking antidepressants did help the mental aspect of it too.
Apologize. I'm going to pause you there. I'm going to hope you'll remember exactly where you left off, just because I hear a lot of people in the community. There's a bad perception of mental health medications. You're talking that it was helpful for you in some regard there, and I'll ask you some questions about that. In my personal experience, because that's primarily my background, is the mental health. Is I for certain people, certain situations, I have seen it help them kind of cope through certain periods of time. So it can be helpful, but again, it's not to be forced on you ever.
No,
But yeah, go ahead with what you're saying. I just wanted to point that out because I know there's sort of almost a stigma with for people in the community to take them,
yeah,
and a push for them to say no, you can solve this by herbs. But sometimes we're a little too far progressed severity of mental health,
yeah.
where you might be dabbling in some of those herbs and realize I'm very far gone now. But to each person, that is their journey, and they can do that. But go ahead, I'll unpause you now. And so sometimes when I unpause, the people forget where they were. I forget where we were, and we just go from there. But it was mental health medications. So.
Yeah, so I never stigmatize any type of pharmaceutical because I think they're needed in specific individuals to help support. So if we need support now, right, then we utilize those specific, whether it's an antidepressant, whether it's an anti-anxiety, whether it's an anti-inflammatory like prednisone, whether it's an antibiotic, whatever it may be. But knowing that we're treating the underlying causes long term, right, and people have that education on that, then sure, it brings more of a sense of ease too, because they also have to get through an everyday life. And, like to your point, like sometimes the herbals, they don't work magic overnight. Sometimes they take longer to work, or sometimes there's other mechanisms going on in the body that the herbs kind of go sideways too. So yes, utilizing specific medications in the short term can provide long-term benefits because we come off of those types of medications because we've restored more of the balance, and we figured out what has happened in your terrain to restore that balance, so the immune system becomes a lot better, and we don't need to utilize those temporary band-aids anymore. But they are really good in specific moments, right, that we need that specific support, especially in the short term, to help. Again, if we're plateauing or we need to progress or we need to sustain, then yes, let's bring it in to help support. Let's add that bridge, right? But we're not going to be utilizing it forever. It's
Right.
just help. Okay, perfect. We
Yeah.
need to support. Awesome. right? Great. Now we can still work on other factors, continue our journey, and not to be stigmatized by just because it's a conventional type of medication that it's, oh my God, I did this all wrong. It's bad for you. It's wreaking havoc. It is not, because you're utilizing the other components of the natural healing perspective to incorporate and help support what medications do to your body, whether that's supporting with like probiotics or detox or liver support, whatever it may be. And then coming off of those because we feel a lot better, we treated other factors, again, creating homeostasis.
Yeah, yeah, perfect. Yeah, and that's exactly how I used to explain it too. Is that this is short term. At some point, have to get to the root causes at some point, and that. But I think it's helpful for people to also hear that some people do find positives from it. So to each their own. But I also had pretty good results with the prescribed medications back in the day for mental health. So for you, was there any certain type of therapy? You said you were with a psychotherapist, or just simply talking to a therapist? Was that helpful in itself?
Yeah, I utilized these back in the day. I haven't utilized them. That was more like in the beginning stages of the journey. So like, between 25 and 27. So now I'm 35. So it's been roughly 6, 7 years that I haven't utilize any type of psychotherapist or any type of medication specifically for antidepressants. It was more of like the short-term use. For me personally, again, they started not to work as effectively. But then at my end of the spectrum, I kind of like, okay, I give up type of thing. I didn't try different other ones too, which other specifics can have different effects too with people. But again, during that time, I was investigating what was going on and obviously got diagnosis and started working on that specific journey, right? So in my case specifically, I utilized those prior to knowing what was going on,
Right, right.
right? Prior to diagnosis of specific conditions. And then obviously getting a diagnosis, you feel depressed because what am I up against type of thing. But then no, I worked with more of the spiritual health coaches. So working on more spirituality and an acceptance.
Okay,
So
yeah,
acceptance of what's going on currently in the moment too as well, which brought a sense of relief as well. But again, combining it with the whole functional types of approaches, NDs, my own personal self, my own personal knowledge and experience too.
right. Okay. Was there anything outside of practitioners that throughout these tough times helped you get through that gave you hope? Was there, for me, it was my dog, for example. 100% kept me alive through the toughest times.
Yeah, I think my social surroundings, right? I mean, I've had a lot of friends, good family, good relationships too as well. I mean, I've had my share of relationships that have gone sideways during the time of symptoms and diagnosis, sure. I've definitely lived and learned those experiences too. The approach of the whole spiritual, not to say that I'm very spiritual, is looking at things at a different lens too. Why do you think you have this going on too? Is it predominantly something from this, a tick bite, or what has gone on prior to as well that your own personal, well-being or your own personal journey has brought you to a state too, right?
Yeah,
So the mental health side, the more of the health coach, spiritual coach, was more of my lenient to just to kind of help bring things together, right? And to help the acceptance component of it, right? While going through a journey, right? Letting go, what to bring in.
and so I've had a lot of, well, not a lot. I haven't done that many interviews yet, but I've done a bunch where a few people have found their religious background super helpful for them. Is that something for you where in
I would say both. I would say I'm not fully like religious in a sense, but believing in a higher self definitely played a role, right? Again, you're kind of letting go and accepting and asking for guidance and protection. And so you don't feel like you're by yourself through the gloomy days, right? You're more like, I have protection, I have guidance, I've asked for support, and brings a sense of more calmness.
yeah,
Plus, when you're focusing even for 5 minutes on those aspects, it gets away from the ruminating thoughts of what I have to even do that day if I have like a busier schedule or I have to be somewhere type of thing. So again, that's self-regulating the nervous system from someone who we can call upon to help gain that additional protection or support, or whether it is more of the spirituality side, who we believe in what rituals we can do, because these are all therapeutic types of not going to say treatments, but these are all basically things we can incorporate, and they don't have to be hours a day. That can just bring yourself just to center just for 5 to 10 minutes.
Yeah.
Slow the pace down type of thing, right? And I think that's much needed for everyone, whether it's incorporating things like breath work, right? Breath work can help you gain your attention to just focus on, you, yourself, your breath. And we know breath work can help regulate the nervous system, so very quickly with even box breathing types of things, right?
Yeah.
So, incorporating box breathing, even going to breath classes, you're scheduling your time to get these therapeutic outcomes too, right? And
Yeah.
I think that's very important with everyone, and even exercise, right? If someone's has the ability to exercise, okay, let's plan our days, right? Maybe it's 2 days a week. Hey, that 2 days a week plays a significant role into self-help, self-healing, self everything, right? And that transverses to everyday life when you start to have that proper circadian rhythm, proper balance in life, right?
Yeah, and I was curious of that too, just to see it, because it's nice also to hear someone mention spirituality in particular. Also, it's nice to have a bit of diversity there too.
It's giving room for yourself to know what your deeper inside kind of wants and entails, right?
Yeah, and quiet the noise. And I heard you say earlier on as well that you queried a bit if you're doing a bit too much at certain points. Looking back on it now, today, would you say that you may have been overdoing a little bit, or
A lot.
do you still have any of those challenges in the recent years with your journey where you have to
I,
kind of talk yourself, have a little chat inside your head where you're like, I want to do this, but
Mhm.
I'm going to maybe pay for it, or
I think that's everyone's, I would say, concerns nowadays, just because life is ever evolving and shifting for people, whether that's having families, whether it's a new job or new careers, or life is more fast paced too right now. I mean, for me, because I've learned those different experiences and now running my own practice, the last 3 years is a learning phase from the whole business admin standpoint, scheduling, structuring appointments and whatnot. And as much as I care for every individual, I know you want to get them in as quick as possible. There is balance involved in that too, from like your scheduling and what you can do and how many people you can see in a day, right? To anyone else's, right? Some people can see 6 people a day, right? Whereas in say I only want to see 3 people a day because my sessions are longer. It's more in depth. Like a lot of energy is being produced, right? Not negatively, but having that proper even break time to kind of do something else, or shift the perspective and not rush to do things like create like protocols and create all their material and whatnot. So yeah, it is, there are times where that has happened for sure, because it's a new experience too. But coming up to those new experiences is always like, okay, if I'm feeling this sensation now of symptoms, whatever it may be, you have to sit with yourself and understand, okay, is it too much? Am I structuring it wrong? Am I doing too much here? Or how do I restructure or reorganize things too, right? So I think it's making the pivots always too. But to make the pivots, you actually have to sit and listen to yourself too. Whereas we're programmed to just go
yeah.
and just go through and go through, and that just stacks, and then eventually those stacks are harder to unstack. Takes longer, right? It's not moving too fast. It's just sitting and utilizing your own time efficiently, and most important, you're trying to do what you can to the best of your ability, but you don't want to overdo yourself too, because then you're just going to go right back eventually too.
Did you have any points where your trajectory was flowing, where you had a pretty big setback? Oh,
You know what? I haven't had crazy setbacks, which is interesting because you hear a
I
lot of
just
people do,
knocked on
right?
my desk for you there. It's what
Yeah.
it
Yeah. So I guess I continue to put focus into my own self and like self time. I think that's always a priority. And again, it doesn't have to be hours and hours a day, right? It could be days off. You structure your days off. You do something out of the ordinary, or you plan your vacations at the beginning of the year, so you have something to always look forward. Those all matter, right? Sure, we have to live in the moment. I think that's great, but we also have to have these other components incorporated too, especially when people are sick, right? We get into the whole the epigenetics and the limbic system type of talk, where you're programming yourself to feel, in stress, in threat on a constant 24/7 basis. Or we have to start programming too, like, our thoughts are training our limbic and vagal system to be dysfunctional too. Sure, there are the underlying players like Lyme and other infections that are wreaking havoc, but these things are almost free to do. We can sit with things for 5-10 minutes a day, or do specific programs, right? Like the DNRS, the Gupta program, Primal Trust, all those programs. Or if people want to do meditation, sure, if they can handle it, by all means. But it's doing things like that to, again, retrain from the cellular level, because I like to get a little sciencey.
Yeah, go
Then
for
how
it.
those how they are expressed out, right? So without the mental component, we're never gonna fully. You have to train the limbic system to feel safe in specific environments, whether that's a stressful environment, whether that's a home environment, whether that's a work event, whether that's family members, whatever it may be. Those are plateaus people are up against, I think,
Yeah,
huge,
yeah,
right? But also feeling the threat of, I have to take this every day, I have to do the same thing, I have to take all my supplements. It's the same routine, and your cells get programmed to do so, right? So which makes you, eventually gets you into a fear state, and then again, that can cause even more mast cell histamine issues, and just causes more immune disruption, which we technically are going to get more flares, because now we don't have resilience to any of these factors. So these triggers are just going to topple us. We're trying to build resilience on the ongoing basis. So when we're up against invaders, whether it's food from restaurants or stressful events at work, our body can cope with it, and the switch can go back to, hey, I'm in a parasympathetic state again.
yeah.
So it's very important, and it takes practice. Just like I practice, I was a pro hockey player. I practiced every day to be good at something, right? I mean, sure, I spent hours, but that was a little bit different. But retraining the limbic system, it plays a huge, significant role in healing. Or we want to enjoy life too. We want to build on health span. We want to keep well until, yeah, of life we go, right? But we want those years to be significant and enjoyment, and have relationships and have experiences too at the same time.
Was there ever a time where neurologically that was pretty difficult for you to do,
Of
or
course.
and was it a coach that kind of helped you then, or I'm just thinking of some of the people that are
Yeah.
still sort of confined to bed, and they're maybe listening to this saying, "I want to do some of these things that you guys are saying." Um,
Definitely coaches, definitely health practitioners, depending on, the practitioner, what they incorporate, in their, say, practices, or um, what they're specifically addressing as that support, right? But yeah, 100% guidance from individuals definitely help to the degree, right? It's our own personal homework too, to utilize the factors that they're obviously referencing or trying to incorporate too as well. But it's whoever you pick or whoever resonates with you should have a firm understanding of this side of the component, especially in chronic illness. Sure, treating the illness is great, but if they don't have these foundations and tools, then they're never going to be able to sustain. And we talk about longevity, right? We need to have the longevity component and the stress support, right? So it doesn't topple our nervous system to go back to the square one. So yes, utilizing practitioners that people resonate with, whether that's health coaching, whether that's, nutritionists, whether that's NDs, whether that's even some MDs, because some of them still utilize all those factors too,
yeah,
whether that's chiropractors, whether that's physiotherapists, whatever it may be. These certain individuals can help support right? Your journey and utilizing what you said back before, it's finding your core team, your holistic core team that's going to provide you the support and resources that you specifically need and resonate with that are going to help you on your journey to support and get to the next levels.
Yeah, I actually refer to it as my A team. So once I found my current practitioner, I was like, hey, yeah, you're on my A team. And then when she said to me, she's a functional medicine doctor. And when she said to me, I learned from this ND naturopath from the States because she's better at me at complex Lyme and co-infections. So I remember I just was like, you're saying like you're willing to learn from people. And I was just so in awe. I was like, wow, respect for
Of
you,
course.
respect for the ND who's there teaching my MD, medical doctor. And so I was like, yep, you guys are on my A team. And so I definitely have a little crew that I consider my A team now.
Even as a like practitioner, you have to be real. So when you're talking to the people, you have to, I guess, speak your worth, but also, hey, like I'm continuing to investigate just as much as the literature is continuing to investigate too, right? And I'm always trying to learn and understand just as you're willing to educate yourself and understand too, right? Not that I'm the person that knows it all and telling you what to do. I'm trying to provide you with the additional toolkits, resources, but I'm also trying to research deeper if I need to research even more deeper and continuing to understand more because research is ever changing, right? So when you have communication with people like that, it brings them a sense of ease, and that's already starting to heal them too,
Yeah.
right?
Yeah.
So that's without doing that or utilizing that with people who I found beneficial because sure, we try lots of practitioners and some are better, some are not, some work well for others, some don't. It's utilizing those components. They're open-minded. They're eager to still learn. They're not your sergeant by all means. They're willing to educate, but they're also there to provide you with all the support you need and be realistic about them and not some people lie. There's a lot of corruption in this world too. By all means, it's not just the MD world, but in this world too, there
Yeah.
is. So again, I think that's why I got into kind of my practice now, where it's utilizing these components as well, or most frankly, most important. But then sure, yeah, I love functional medicine. I love the research. I love doing testing. I love diving deeper. And yes, I get a lot of positive feedback where you know more than naturopaths because I'm just like a holistic nutritionist. I'm like, that's great. Thank you. I appreciate it. But they know so much too, right? They study a lot. They've gone through education. So we don't want to be judged differently upon like educational reasons, right? We're all a team, right? We're trying to work with each other and never kind of against each other too. And if we have to reach out for support, then we do so. And that's again, when someone works, say with me, for example, it's like you're working with always a team. You're never working solely just with me personally. Yeah, I may know a lot,
Mhm.
right? But I'm also utilizing my resources too to help you as an individual and give you the toolkit so you can heal too, right?
Right. Yeah. Do you have, as a practitioner, a favorite niche within all of these other ones? Like, for this is a random example. Like, some people love gastrointestinal and they study that till there's no more books. They've read so much on it. Or some people like the mental aspects. Do you have something you'd say is your favorite area of this type of functional medicine?
I do like the complexities. I love being that detective for them when they don't suspect that they have, right? Like some don't suspect they have like mold toxicity or tick-borne infection. I love being that person that dives into the complexities just because when I say that's not a specific condition like GI issues, sometimes like having the GI issues is things that are stemming from outside the GI tract. I think utilizing environmental medicine is a huge factor. So I love to focus on a lot of detox support, mast cell support, Lyme, tick-borne, mold toxicity. I think that's kind of my few areas. I wouldn't think there's one specific. It's just they all kind of go hand in hand usually
Yeah.
when you kind of are starting to suspect different underlying root causes or factors that are affecting different mechanisms in the body. Sometimes it's utilizing that specific mechanism to just correct that symptom and then people feel relief, which is great. But I'm like, okay, this is just a band-aid, which is fine too. that gives more clinical answers. So I love the complexity of like this, the whole functional medicine type of approach.
Kind of
But I
like
also,
the investigation of it all
yeah,
and the
I love the
finding.
investigation.
Okay, yeah, because I was curious about that also. My guess would have been that you probably like the hard, complex,
Yeah.
intertwined type of digging cases where you gotta really figure the whole thing out type of thing.
I love the complexities, and testing can get quite expensive too. And then again, using my own experiences, we don't have to run every test at the start. I think utilizing the test to get additional answers is great. Sometimes the tests are going to provide what segues that we need to go down that's going to provide value in doing another test. Usually I rank them on a totem pole of symptom pictures, conditions they're diagnosed with, because finances mean a huge deal, especially in today's world, right? So what's the value in running labs if we need to run specific labs? Or what does a GI test or an organic acid test going to signify? Hey, is there colonizations of, say, specific mold markers? Okay, that gives me indication that there could be environmental issues, whether it's current or past. Do I run a mycotoxin test, or do I prep to do it, or do I use specific binders instead because my susceptibility or my suspicion to it? So I love that part of it, but then I never forget the whole going back to the holistic approach where it's utilizing the whole self-worth and energy types of approaches, whether that's listening to the specific frequency medicine, whether that's incorporating specific nutritional components. If I run a GI map and I see low archimenzia, it's not like I'm going to give an archimenzia supplement because in Canada it's very hard to get,
I
and the
don't even.
cost.
I'm not even familiar what archimenzia is, to be honest.
So
Yeah.
archimenzia is like one of our keystone bacteria. So
Oh, okay.
when you run a stool test, it
Hmm.
shows all your good bacteria. Archimenzia being one of the keystone types of species. We tend to see it lack thereof nowadays because of like the whole mucin layer being disrupted.
Okay. Yeah.
So now they've made, you've probably seen them publicized in the States, like archimenzia types of probiotics. But we can use specific foods now being researched, like, dragon fruit. Dragon fruit's known to increase, archimenzia levels, or polyphenols. So incorporating more polyphenols into a sitting or into a breakfast or into specific meals of the day. So again, working still on the nutritional aspect combined and not getting too lost in the functional medicine approach. I think, if someone's strictly in functional medicine, they strictly do that, which is great. Whereas I kind of incorporating like these lifestyle nutritional aspects too to help the whole perfect circle and not get too in the weeds of crazy supplementation. I think at times it's needed for sure. But using the right amount and like herbal therapy and whatnot to nutritional deficiencies, sure. But yeah,
Is
it's
it?
it's amazing what we can find and see, and that's where the details come in from the functional, like looking at specific microorganisms, where we can utilize these things from a lifestyle perspective. If we can't, sure, there's specific supplementations. I use a lot of American products in my Canadian practice because they tend to be better, or there's more of, or the formulas are better, or there's more research into these specific areas, whether it's mast cell or even things like salicylate issues or thiamine deficiency. We get into the weeds of like the whole oxalate stuff. So sure, these are getting into more detailed complex where people are like, they don't really know too much about either. They know all these broad things like mold, parasites, and fungus.
Yeah.
Well, sure, it's way more to that, and it works differently in certain individual according to what's their terrain has looked like too,
Right.
right? So it's very important to always, well, I combine all those aspects. So I utilize it as more of like a program type of thing where it's like you don't see me once, you see me at least 5 times, right?
Okay. Hmm.
So it's the value is there. I'm always putting value, and the commitment is there too. I'm committed just as much as you want to be committed to change, right? And understand and be educated. And also I take education from people too. I learn different things as well, which
Yeah.
is which is great, right?
Super
So
important. Yeah. You can tell
yeah.
you can tell that you seem quite passionate about it. Do you think that you would have still wound up in the employment that you're currently in had you not become sick with Lyme and co-infections?
Interesting question. Well, maybe if I didn't get ill, because I was playing pro hockey, right? So maybe it would have escalated there. If I didn't get sick, I definitely wouldn't be in the field I am today. I was still working out. I always wanted to be in like the personal trainer type of field. So still in the health and wellness, but not into this sides of the health and wellness. So definitely not, right? Well, maybe you could say that now, but it wasn't my plan to be a practitioner from day one for sure, right?
Okay.
Definitely not, right? Not even to like run a business too. No, for sure not, right? And supplements, I'm developing supplements and again, developing supplements to make it feasible for people to take instead of taking so many too. How to structure everything, or even Canadians, how to give resources to these American products where I can sell specifically. So they can get things quicker because downfall of Canada in general is when you're working with complexity with say a practitioner, even if you're working with a practitioner in the States and they're telling you to take these supplements, well, it's like 2 to 4 weeks before you even get them.
Yeah.
Potentially. So I'm utilizing some of their products where I help companies in the States where they can contact me to get supplements quicker, helping again utilizing these specifics because Canada lacked thereof. And in these complexities, yes, we need these certain aspects too.
Yeah.
So we're trying to help on all ends of the spectrum, not just from, hey, a practitioner, you're seeing me in clinic, but even resources, even supplements or other practitioner references, or here's a here's a holistic psychotherapist that works in my clinic. So again, we're always trying to provide all these resources for the individual to utilize in their journey
Yeah, that's
as
awesome.
much as
Yeah.
much as possible.
Mhm.
Never just like I'm the solo or we're the solo people type
Yeah.
of thing.
Yeah, it seems more of a team and getting people connected to what they might need, whether it's within exactly where you work or nearby.
You structure it according to the individual because they want structure too, in a sense.
Yeah.
They want to feel comfortable. They want to be racing around where to get things, how to get things too. So that's all should be incorporated, not
Yeah.
just like here's an email what to take, and then it's like, well, where do I get all this?
Yeah, yeah. Then you
Right?
start
Oh, this,
putting out the posts in social media, like, "Hey, can anyone hook me up? Do you live near the? Do you
yeah.
live across the border, or where? Can I?"
Yeah. So that's part of it, right? Like people need those resources in education, not just what the practitioner is offering from a protocol template sheet.
Yeah,
There's way more to it, right?
so
So
complex. All of this stuff. It still blows my mind. So you said you probably don't think that you would be in the current position you're in now had you not become sick. Is there anything else that you think you probably wouldn't have done or, come to the place you are now if you hadn't got sick?
yeah, honestly,
Relationships?
I think if I'm looking at the path I was going, being that person who was not the real person who they should be, it probably would have escalated to be even worse, right? Maybe even get into more specific, like other conditions too, because not that I was an abusive drinker, I just like to drink because, parties, hockey player, sure,
Yeah,
right?
yeah,
So it probably would have pushed me into a direction where I wasn't supposed to be. So I definitely take the experience as a positive too because it redirected me into a specific area that I wasn't even thinking about. And that entails having your career, your lifestyle, your relationships, right? And your whole longevity, right? Whether it's a family, whether it's significant others.
yeah,
Yeah, thinking back for sure, I think it would have gone in a direction where I'm not supposed to go.
yeah.
And the acceptance there was part of the journey too.
Yeah, it seems quite the journey, and for you also a long one. Is there anything that you wish someone
Yeah,
maybe told you as you were going through it?
yeah, I think it resorts back into it's not trying to find the one person that's going to help you. It's finding that core team and accepting and kind of surrendering of what they, are offering too. I think people in our world of complexities, they're always trying to be their own doctors too, which is fair because of all the groups, the Facebook groups and whatnot too, right? But there is more complexity to it. Practitioners like myself, sure, I've gone through it, I've learned, but I learned even more while studying too. So sure, people can post a lot of things, which is great. This worked, that worked, awesome. But does it obviously correlate to you? Is it the right time to utilize that? Or what are the other conditions involved with it, right? that's where I can educated myself more on like when to use specific things, how to use them, what does it entail, right? But again, it's always, working with a core team. If I was told that from the beginning, I think things would have been a lot different, meaning I would have, you know, healed by 30, for example, and then life maybe would have been different. I maybe have kids or whatever, right? So not to say that that's bad in a sense. It's just the journey and experience obviously made the person I am today, which is great. I think it's brought me to a next level. But if I was told that you need to work with a core team that understands the whole picture, then yeah, for sure, 100%, right? I wouldn't put my eggs in, to be honest, in one basket type of thing.
Yeah.
I mean, it depends on people's finances, sure. So if you're finding someone, yeah, make sure they know multiple components as well. But also, obviously, if, we're talking about Lyme, they understand, the mechanisms behind that and how it is to treat. Are you treating Bartonella? Are you treating Babesia? Are you treating the persister cells? Are you treating the three forms of Lyme? Are you treating biofilms? Are you treating all that kind of entails with it? Because usually there is other co-infections potentially,
Yeah.
plus the environment, plus detox, plus mitochondria, plus histamine, plus mast cell, go down the list, right? So yeah, it could be very difficult from a financial side if you want a team, but if you were to pick someone too, it's just, yes, find someone that has that communication with you, that's there to support you. Plus, the other side is knowing the research, the education, the treatments and whatnot, where things can go wrong, how to refer out if we need to refer out to other NDs and whatnot too, right?
Yeah, and that is super helpful to hear that, because I know even myself, different times, people told me when I was first searching for a practitioner, and I said, but they have to be specialists in SIRS, mast cell activation, mold, hormones. Oh, I wanted to ask you, it depends how much time you have here.
Yeah, yeah, for sure.
Because you mentioned that your hormones were thrown off by this stuff, and you said even being a male. So can you tell us what you mean by that? Because the female hormone people, they get a significant amount of information. Not they probably want more, but in terms of the male in particular, I'd be curious how that affected you.
So, I mean, obviously males are not as much complicated as women with the whole steroidal pathways.
Yeah.
I mean, men, testosterone, right?
Yeah.
Testosterone plays a huge role in muscle mass, muscle gain, libido, and whatnot. When men get into trouble with hormones, it's usually some other factors affecting the hormonal system. So you could look at the cholesterol, you could look at triglycerides, or say your full lipid panel. You could look at all your inflammatory markers, ferritin markers. If they're elevated, it can have an effect on libido, right? You could look at specific nutrient deficiencies like zinc, for example, or with men, I find the whole mast cell piece, right? Like mast cell libido is actually a connection. Like even prostate, right? Prostate libido or urinary, they have an affinity from an inflammatory type of condition. So, I mean, utilizing mast cell support can potentially help those conditions, right? So, I mean, again, male with hormone dysregulation, you're gonna have the mental instability, whether that's thumb's going up. Mental,
Did
mental.
I do that, or did it
I
just?
don't know. I don't know.
I didn't do that.
Maybe it's my side. That was cool. But they'll have like the mental instability from libido issues, lack thereof interest,
Mhm.
right? I think those are the main things for men, but it has multiple like components to it. But I think with men, like especially if they're like at a younger age, it could affect if they're having libido issues. It could affect their mental state even more,
Right.
right? Because hey, I'm 26 or 30 and why do I have ED type of thing,
Yeah.
right?
Yeah.
That is not normal, right? So it starts to affect their mental capacity, which actually make things even worse,
Yeah.
right? So
Okay. So yeah,
whereas women, yeah, women a little bit more pathways there.
yeah. There's a whole mess, Matt, that I've
Yeah,
experienced. It's ongoing, but it's not as bad as before.
yeah.
Um, but so it sounds like from the males, you mentioned a few things that can be looked into, like with the testosterone in particular. Does it? I don't know if it typically goes up or down then, or
It's weird because you can have normal testosterone levels and still be experiencing that symptom, right?
Okay.
So it's from blood work if I have normal testosterone or normal free testosterone, for example, and I still have these specific issues. It's, well, what's causing that to happen in a sense,
Right.
right? Again, if you have chronic infections and whatnot, sure, it's going to wreak havoc on the system in a male or female specifically, right? So it's you have to work on those other aspects too, instead of just looking at kind of a point too is blood work in general tells a story, but it's never, you can have normal blood work and still have like chronic issues.
Yeah.
So I've always had normal blood work, but abnormal functional lab work.
Okay. Gotcha.
So even from the hormonal standpoint too, right? Like you can have normal testosterone, right? But then still be suffering in a sense. Or, for example, having low testosterone and then you're given injections 3 days a week and your symptoms don't improve, like your testosterone level's too high now, or your testosterone level's normal.
Yeah.
So
Yeah.
it's like, okay, well, what's actually going on, right?
The underlying. Thanks for kind of adding a bit of detail to that. I could throw more questions at you, but I promise I wouldn't keep you here all day. So this is a very short question, and it will be the final question.
Sure.
Is where do you attribute your resiliency to? Is it earlier in life? Most people that have survived the journey this long, there's an element of resiliency. So if you had to say some roots of where yours came from, where would you say it came from?
I mean, sure, I was trained and raised as a hockey player, so always having resilience and dedication and mindset, sure, played a role, but I think I gained it more from the experience, 20 ever since the journey basically started from a diagnosis. Maybe not prior to that, during those 4, 5, 6 years when I was just had symptom picture but no diagnosis in a sense. And then having that diagnosis, sure, that put me on a journey. I would say even after all those events happened with all different types of treatments and going to treatment centers in the over the states and having relationship stuff happen and all that entails. The last I would say, let's say from 30 on is where I built more of my resiliency as I you know went through all those steps, meaning like I took things into my own kind of control, like work with a naturopath, sure, to gain additional resources, working on more of the self-worth, working on more of the energy side as well, continuing to researching, having balance. Times still struggled with that, of course. I think we all do at times. But then just building the resiliency as an acceptance of myself, who the person I'm becoming now, right? How I'm starting to develop again into a different person, not starting over in a sense, just, hey, I'm developing into this new person that my body deeper down really wants me to be
Yeah.
in, right? So, and even that is practice. I think everyone should be always developing regardless in a sense. So I would say not from the start. I mean, I have my roots from, playing hockey and dedication and mindset. I think that plays a tremendous role. But then going through like the process of illness, I think it retrains or redirects into a different direction. But it's up to the individual to kind of find that too and
Yeah.
build on that resilience too.
Yeah. So it sounds like even recent years, then you're still gaining and
Of
using
course, I
more
think we all should
resiliency.
be.
And aside from that, unless you have something you'd like to share with our listeners,
I
no?
think I think there's always hope in this field of complex, let's say, chronic illness, right?
And you're
Again,
living proof of that. For people listening, I'm living proof that you can slow and steadily heal. It is possible. So that's the first thing there.
yes, it is possible, and it's honestly to never give up either. I think people over the years they tend to slide out whether that's cheating on meals, whether that's stopping supplements, whether that's just I'm done type of thing. I think it's always in a safe state, right? In conscious states, never to give up and always to keep, fighting. But again, in a safe space, not like you're running around like a maniac,
Yeah.
right? You're
Like when you're
just,
ready to
yeah.
fight. Yeah.
You're always willing to explore and gain more education and seek out, right? Not in a state of fear, but in a state that I'm here to still understand why I'm feeling symptoms or have an illness, right?
Yeah.
And then continuing the process and always trying to figure out the whys, right? But again, in a safe, conscious space, not running around, right?
Yeah, a compassionate curiosity. Thank you for sharing that advice with the listeners. I appreciate it. And thank you for joining me as well here on the Your Lyme Matters podcast.
Thank you. I appreciate it.
You're
Thanks for the
welcome.
time.
My pleasure.